Hello, everybody. We're going to get started in just a few minutes. Thank you. All right. Welcome, everybody, to today's webinar, Sustaining the Movement, the State of Children's Savings in 2020. Appreciate everybody for being on today, and we hope you're doing well and staying safe. Next slide, please. My name is Oliver Robinson. I'm a program associate at Prosperity Now with the Children's Savings team, and I'm going to walk us through a few housekeeping items. Next slide. So keep in mind that this webinar will be recorded and made available to all registrants. All webinar attendees are muted to ensure sound quality. You can ask a question or share your thoughts anytime by typing into the text box of your GoToWebinar control panel. And if you experience any technical issues, email gotomeeting@prosperitynow.org. And today's speakers will be Aaron Thiemann, a program manager with Prosperity Now, and Ikram Kaliso, a program manager with College Bound St. Paul. And with that being said, I'll kick things over to Aaron for today's objectives.
Hello, can you guys hear me okay?
Yes, I can hear you, Aaron.
Okay, thanks, Oliver. Thanks, Oliver. Okay, welcome everyone. Our objectives for today's webinar are 1, to highlight findings from the CSA Program survey, and 2, to discuss trends in the field and implications for CSA programs. We're lucky to be joined by Ikram Kaliso, the program manager at College Bound St. Paul, who will be joining us later in the broadcast. To get started today, we want to get a sense of who's in the room. So I'm going to launch a quick poll and ask, what is your role in the CSA field? Looking at our attendee list, I see some familiar names and lots of new ones. So excited to have you all join us today. And we'll give folks just about another 10 seconds or so to answer before we move on. All right. And if you guys can all see this poll, it looks like we have about nearly half of you are CSA practitioners, about 24% are just here to learn more about CSAs, and some mix of policymakers, funders, and other. Feel free to let us know in the comments if you have, you're here from some other group. So we're gonna go ahead and talk about the state of the children's savings field. So first, we want to share our brand new report called Sustaining the Movement, the State of Children's Savings in 2020. This is a new report. We released it on March 18th. And in this report, we present findings from our annual program survey, and we aim to present a snapshot of the children's savings field. This report offers a lot of detail, including the size and scope of the children's savings field, and provide some insight to what we're seeing across the field, from everything from program model to program components like long-term goals. We won't cover everything in the report today, but it is available online for further reading. And Oliver is going to drop in the chat the link to the report. Okay, so where do we get the data from our program survey? So from our program report. So every year we release an annual survey. We first started releasing the survey in 2016. We fielded the survey from October to November of this fall, and we got responses from 25 programs, and we included additional data for a further 22 programs from public information from our partners and past survey responses. So we have a good snapshot of the field. Some new features for this year, we included some questions on COVID-19, and we offered some new details that we have not published before on program contributions or incentives. So what is a CSA program? How do you get included in this report's data? So for our purposes, a CSA program is a long-term savings or investment account for children and youth 0 to 18. A CSA program uses their accounts for asset building purposes, usually for post-secondary education, although some programs allow other types of uses. They generally restrict account withdrawals, and they provide program contributions or incentives to help build savings, either a seed deposit or matches. In addition, for our purposes of inclusion in this data, programs had to be in operation or in development and planning to enroll by the end of 2020. So there are lots of CSA programs in development across the country. They were only included in our data if they had enrolled participants as of the end of 2020. So now to get into our findings from the report. So the first is, despite everything that has happened in 2020, we still saw growth in the field, in the CSA field in 2020. We are now reporting 109 active programs, up from 79 in the year before. The increase in 2020 reflects two things. One, an increase in new programs in 2020. We report that 6 new programs launched in 2020. And another is a methodology change on our end. So in previous years, we have reported one program, Promise Indiana, who has multiple sites as just one program. This year, we have changed our methodology to count them as distinct programs that operate across the state of Indiana. So we're at 109 programs, which is a large jump from just a handful of years ago, back in 2007, which was the launch of Seed for Oklahoma Kids and some demonstration projects in CSAs. We've seen a big jump beginning with kindergarten to college and other programs that launched in 2011, and we expect to see continued growth in 2021. On our next slide, we also see a corresponding growth in the number of participating children and youth that have a CSA account. We're reporting that over 922,000 children have a CSA as of the end of 2020. And we know that that number has increased since we've compiled this data as programs continue to enroll children every day. In 2019, we reported that 707,000 children had a CSA account, which means the number of youth has increased over 30% from last year. This increase is driven largely by continued enrollment from large-scale programs such as statewide programs and large municipal programs who continue to enroll cohorts of children every year automatically. And the 6 new programs that launched in 2020 that I just mentioned added an additional 8,000 children to this number. So we're continuing to see, as in years prior, our growth is largely determined in the field by these large-scale programs that are enrolling thousands or tens of thousands of kids each year. Our next finding is related to enrollment type. So this is how CSA programs enroll their participants. This is a trend that has continued over the past couple of years. And for this analysis, we looked both at program type, or by program and by participant. So the graph on your left-hand side shows when we look at this data by number of programs, and the graph on the right shows looking at this data by participant, so by child or youth, everyone under 18. So what we see when we look by program type is that 64% of programs use opt-in enrollment and 33% use opt-out. Opt-out, also called automatic enrollment, does not require any action from a parent or guardian to enroll in a CSA program. But when we look at the analysis by participant, we find that most kids that have a CSA account are enrolled in a program that uses automatic enrollment. So 82% of participants are enrolled in opt-out programs. On the account type, we see the same story play out as well. The trends are consistent here. So when we look by account type, we find that it's about half and half. About 49% of programs use 529s to hold funds, and 48% use custodial savings accounts. So when we say 529 account, we mean an investment account that's held by the state. Every state has a 529 account, has a 529 plan available to them, and 48% that use custodial savings accounts are held in banks or credit unions. I'm getting a notice that these slides are a bit cut off on the right, so let's see if there's anything we can do about that. One second, let me just reshare this really quickly so we don't have this cut off for you guys. I don't know if that's any better, but we'll see. So we see the account type tells the same story. Most of the participants that are enrolled in a CSA program are enrolled in a large-scale program, and we know that all of our statewide programs use their state 529 to hold these accounts. Let me see if I can zoom out really quickly. Okay, I apologize. We're having some technical issues on our slide being cut off. We will definitely share the slides after the webinar. I'm not quite sure what's going on, why our slides are being cut off on the right-hand side. My apologies about that. On our next slide, we are looking at program contributions, also called incentives. So this is something where we've changed the terminology slightly this year relative to last year. We are now moving toward calling our incentives program contributions because we believe that better reflects what the program is offering, and they're not necessarily incentivizing a particular behavior. What we see in our data is that 76% of programs are offering an initial deposit, and the most common amount of that deposit is $50, followed by $25, and then followed by $100. So most programs are using $50 as that initial seed deposit amount. We also see that 72% of programs, so 3/4 of programs, are offering at least 2 types of contributions, and you'll see those detailed below. So on the chart that you're seeing in front of you, the initial deposit is in that teal color, and then we have categorized our program contributions into 2 categories. The lighter red color is for savings-related incentives or contributions, so that includes the savings match, the benchmark incentive, the savings match, the deposit bonus, and prize-linked savings. And the darker red color is benchmark incentives, also called milestones. The next slide is just looking at the program contributions by participants, just like we did for the account type and enrollment. And when we look at the account type, or when we look at program contributions by participants, we see that benchmark incentives drop significantly, and only 6% of participants are enrolled in a program in which benchmark incentives are offered. We believe that this is because benchmark incentives, which reward things like completing a financial education activity or a milestone like a child's birthday, are more administratively complicated to administer and thus are not offered as commonly across large-scale programs. So what we see most popular are savings matches, prize-linked savings, and then deposit bonuses, which we'll get into incentives in a little bit more detail when Ikram joins us. The next slide before we move into our discussion is just a question about funding. This is a question that we get every year from programs that want to know how programs are funded and what types of sources are providing funding for CSA programs. So we see that individual donors, the top bar on this graph, remains the most common source of funding. And this year in our survey, for the first time, we asked programs to both list all of their funding sources and rank them in order from largest to smallest. So as you can see in the graph, we see more programs selected individual donors, but foundations continue to provide the largest source of funding for CSA programs. We also see we don't have a lot of federal funding for CSA programs, and we see state and city county continue to grow as CSA programs develop, with a number of states dedicating specific pots of funds for CSA programs over the last year or 2. We also see that 529 plans, while they don't provide funding for a lot of programs, the funding that they do provide is significant in that most programs who listed a 529 as a funding source ranked it as their first source of funding. So that's a little bit of a snapshot into what we saw in our data. Again, I apologize if the slides are slightly cut off. We will send the slides out after, and you can find more details and lots more graphs in our report. We're going to move away from me talking at you and sharing slides and bring in Ikram Kaliso, who's a program manager at College Bound St. Paul. Ikram, welcome to the webinar. If you want to unmute yourself, we can move into the discussion. Hi, Ikram, can you hear us?
Erin?
Yes, we can hear you.
All right, perfect. And then can you see me, or is that a black screen? I see a black screen.
I cannot see you. I can see that your webcam is on, but I can't see you.
Okay. All right. Well, I will troubleshoot that. Apologies.
All right, Ikram, so if you want to just give us a brief overview of your program and your role at College Bound St. Paul.
Yes, so I am, okay, gotcha. I see why. There's another link open, a Teams link, that's why. But yeah, I'm Ikram with the Office of Financial Empowerment with College Bound St. Paul. Thank you to Prosperity Now for the opportunity to share more about our program today and how we've been able to adapt over the past year, because our program launched right essentially at the beginning of the pandemic. We launched on January 1st of 2020, and then a couple of months in, the pandemic hit. As far as College Bound St. Paul goes, it's a program for all babies born in St. Paul beginning last year and going forward, and that also move into the city going forward. It's a universal automatic enrollment, but we also have manual enrollment. So all babies in St. Paul are eligible. However, for babies that have confidential birth records or that move into the city, we have to automatically enroll them. And then two major key cornerstones of our program is connecting families to early childhood resources as well as financial health resources.
Erin, sorry, we're not able to hear you.
I apologize. Okay, can you guys hear me now? I'm sorry, we're having so many tech issues today.
Yes, I can
you guys
hear you
me
now.
Okay, awesome. Sorry about that. So I'm sorry, while I was on mute, I was saying that what Ikram just brought up, we have found in our survey data, which is that our number one issue that 83% of our participants indicated was that they had difficulty engaging with participants and families virtually. And second, 58% of our programs indicated that families were experiencing significant financial hardship. So I was wondering, Ikram, if you could talk a little bit about those two findings and let us know what were the biggest challenges that you faced, not only launching a program in a pandemic, but what your experiences with families were during this time.
Yeah, most definitely. So just to provide a little more context around our program, we partner with Bremer Bank, and then there's a $50 seed deposit that all babies get, as well as additional bonuses to help the accounts grow over time, including when families log into their savings portal for the first time. We have an equity bonus, which I'll talk more about later, a child wellness bonus, financial health, opt-in bonus, first birthday, and a few others. And I'll be focusing more on our People's Prosperity Guaranteed Income bonuses that babies get as well. But as far as sharing what we've had to do to adapt to COVID-19, like I said, we launched and then right away COVID hit. That impacted a lot of our staff time because a lot of us were triaged to help with projects related to COVID. And then also our outreach and engagement efforts were impacted both at the programmatic level of what we were able to do as staff, but also what our partners are able to do. So a lot of the events that would be happening in the community that we would normally go to and communicate to families about College Bound and help them get enrolled, or if they're already a part of the program, then encourage them to engage with the account and with the program. We weren't really able to do for a good part of the year. And then our partners were also in crisis mode in the moment, and so they had to really focus their energy on helping families meet their immediate needs, which related to housing and then a lot of the financial crisis that a lot of our residents and families were going through. So those were some ways that we were impacted. We had a plan to actually do our first family savings weekend last June, and we weren't able to do that as well, just because of social distancing and all of that. And of course, our families' safety is the most critical, especially considering that they're all families with new babies, and so we weren't able to do some of those things. But later down the road, we did a drive-through baby shower, which I'll talk about later. But the other part that was impacted is that we couldn't focus as much on telling families to save for their accounts. So that really had to be dimmed, and it was a little bit softer, just because we know that families were already facing a lot of hardships due to unemployment and things like that. So a lot of what other programs have said were challenges were similar things that we faced. One last one is just delays in actually getting our savings data, right? Actually getting communication out to the family to let them know that they have an account and for them to begin engaging with it. So those were definitely some ways that we were impacted.
Thanks for sharing, especially as you've tried to adapt to all of the challenges that have come your way with launching a brand new program and building that trust with families in the middle of a pandemic where everyone is trying to get resources out early on in 2020. So on the next slide, I wanted to talk about some of your adaptations to COVID. And so we see kind of the flip side of, we see the challenges of changing outreach. We saw that the most common adaptation was moving things to virtual or COVID-friendly activities, especially early in the spring and summer. And you guys at College Bound got really creative with some of your virtual or COVID-safe events. So I was wondering if you could, in particular, talk about some of your COVID-safe events that helped you reach families, like your drive-through baby showers and other adaptations that you guys made.
Yeah, definitely. So the tough thing was that because of the timing of everything, a lot of our families, we had never actually communicated with them because their babies were just enrolled. And so it's usually easier to move from in-person engagement and outreach to virtual if you've already engaged those families. But if they're brand new families, then it just adds an additional layer. But as far as things that we were able to do to adapt, we partnered with our community organizations to just really make sure that they were able to get word out, because a lot of the programs and services provided by our enrollment and referral partners eventually did go virtual. And so even though we weren't able to talk to families directly in the ways that we wanted to, our partners were able to do that kind of a little bit down the road in the year. So that was extremely helpful. And then we partnered with a number of community organizations to host our community drive-through baby shower, which was basically to help engage families and help expecting families as well as eligible families pre-register and enroll for College Bound St. Paul. And for that, we worked with our emergency, emergency EOC to make sure that it was safe and that we were able to follow the protocols to ensure that everyone's safety was at hand. We provided diaper bags to those families filled with essential baby products, and it just was a lot of fun. That idea actually came from one of our ambassadors who is, she's pretty incredible, and all of our ambassadors are pretty incredible, but the fact that that's something that we can do now going forward is super exciting. In addition to that, we started our People's Prosperity Guaranteed Income Pilot Program, which was partly also a response to COVID-19 at the time. And that was announced by Mayor Carter via an executive order, and basically is to help, provide more cash flow to randomly selected college-bound St. Paul families to help meet some of their basic needs. And so that was one other piece, and I can talk more about that later. But as an overview, the PPP program has 150 families currently participating, and they receive $50 a month for 12 months. In addition to that, those families also get an additional $10 in their CSA accounts. So they'll get a total of 180 total for the 18 months that they're participating. The eligibility for that is that the family had to have some COVID impacts, whether it's, they lost their job, or they, didn't have access to childcare anymore due to other COVID impacts. And then they also had to have income eligibility, so had to be at 300% of the federal poverty guidelines. And then in terms of eligibility, it had to be college-bound St. Paul families, and we were able to select 60% of our auto enrollments and then our manual enrollments to make sure that reflected the actual population of our group. So those were a couple of the things that we did. As far as community events, we still were able to do some of that during COVID. Of course, when it was available, a lot of those were outdoors, and so we were able to make that work, and that's something that our program staff as well as our ambassadors were able to participate in to help get the word out. So those were just a couple of examples of things that we were able to do to adapt.
Great, thank you, Ikram. There's a lot there and a lot of really interesting adaptations that you shared. I just want to give a quick plug for our question and chat box. If you have any questions about some of the adaptations that Ikram just mentioned, please feel free to drop them in the chat now. And we will be doing a Q&A at the end of this discussion, and we'll try to get all of your questions answered. I know that talking about guaranteed income or other cash assistance pilots are getting a lot of attention right now. We're starting to see some of those pilots roll out across cities that already have a CSA, and some cities where there's not CSA activity. So the fact that your city's guaranteed income pilot was specifically designed with your CSA program in mind, and that you're recruiting families for the program directly through College Bound, I think is really unique in this space. So if you have any questions on that, please feel free to drop them in the question box, and we'll make sure that we bring those up. There were two things, Ikram, that you mentioned when talking about adapting to COVID-19 that I wanted to dig into a little bit further. The first was that you mentioned that the drive-through baby shower idea came through one of your ambassadors. Could you talk a little bit about what the ambassador program is within College Bound St. Paul, and kind of how you have worked with your ambassadors during 2020 to help lift up your program and generate engagement?
Yeah, definitely. So the Ambassadors Program is one of the exciting parts of College Bound St. Paul. So initially during the task force process, when we were designing the program, we knew that it was really important to have people from the community at the table to help design the program, but then also make sure that they stay, involved post-launch, to make sure that they're the ones that are, talking to families about College Bound St. Paul. So we know that trust and rapport is really important to families. A lot of the people that we did focus groups with told us that it was really important that they hear from, and that the information they're going to trust are those that come from people that look like them, people that they know in the community, as well as organizations that they recognize. And so that's where our Ambassadors and Champions program came through. So last year we had our first cohort of ambassadors who were from across the city with diverse backgrounds. We had students, people that were YouTubers, people that had been in the community for a long time and already doing some work with families with young children. And so it was just an exciting opportunity for an ambassador to step up and say, hey, this is something that we might be able to do now to adapt and provide us an opportunity to not just enroll babies are eligible, but also help engage expecting babies. Because if a family is expecting at this point and they're a resident of St. Paul, they're able to pre-register for College Bound in advance so that we can communicate back with them after they've had their baby, because we know that at the time of birth is a really busy time. So our ambassadors are pretty incredible. We just finished recruiting our second cohort of 26 ambassadors that are going to help get the word out for, the next year. But, ambassadors, I would say, even as we were adapting and we were able to go to events during COVID, like ambassadors played a huge part in that. So that's that. And then our champions program, which I mentioned, is both at an individual level as well as an organizational level. And those are just people, organizations that say that they endorse this program, and we put their names on our website. And in the future, we'll put them in our communications to let people know that, like, these are people that have said, like, thumbs up for College Bound St. Paul. So families are going to be more likely to trust the program and actually either enroll or engage with the program if they already haven't.
That's great. And could you share maybe an example of one of your community partners and how they get the word out about College Bound St. Paul within their organization? I know you guys have spent so much time working with your community partners and training them on the ins and outs of College Bound St. Paul and really kind of working together.
Yeah, most definitely. So one of our key partners is the WIC office, right, which is through our St. Paul Ramsey County Public Health. And on a monthly basis, they send over referrals. And in a lot of those cases, like, somebody has already took the time to talk to the family about College Bound St. Paul and help answer some of their questions. And then, we can also help families answer further questions down the road. But WIC has been key, because oftentimes those WIC families have a person that they talk to and have worked with for a number of years if they had other babies, or even when they were pregnant, and also will be working with long term. And so they've been a critical partner. Essentially, their workers talk to the family whenever they sign a form saying that, they're allowed to give the family's contact information to us. And then on a monthly basis, they just send us a list of those referrals. Another partner is our St. Paul Public Housing Authority. And for them, they've done flyering to all of their residents, and then also did a targeted approach where when families report to their management saying that, they've had a new baby, then, one of their staff members will take the time to give them a flyer about College Bound St. Paul and give them information on how to enroll. And then as far as like the flyering goes, even though those not all of those families are going to have new babies, they still kind of help us get the word out there, because if it's not them, then maybe they have another friend or a family that is currently a St. Paul resident or will be a St. Paul resident who could be eligible for the program. So we kind of look at it both ways. Our obviously niche population is families with new babies, but we want to build awareness over overall. And then we also just got a new partner, Highly Q Brown. They have a childcare center that they run, and so their childcare workers will be able to help talk to families with newborns that they know of, or even if a family has an older sibling, then it's still good for them to know, just in case they have another baby in the next couple of years. And so that's one example. And then a number of our other partners that we're in the process of recruiting right now are our Office of Early Learning at St. Paul Public Schools, and within that they have a number of divisions, and we're excited about that, as well as Head Start, which all they do is all around families with newborns and providing home visiting and things of that sort. So those are all in the works, but those are some specific examples of what families do. We have some culturally specific organizations that have staff members that speak languages that are able to provide their information in that. Our current materials, our website, our flyers, everything is currently translated into 5 different languages, which are like the primary 5 languages in St. Paul. And so that's really helpful. But when we have a partner that actually has staff members that speak the language, that just takes it to a different level, because oftentimes it's not even just about the translations, it's about having someone available that you can ask questions to and get clarifications on. And then it just helps, you know, build that trust, because oftentimes those families that like need the translated materials that are a little more reserved and are willing to like jump into something that they're not comfortable with. And so that word of mouth that the partners provide within their specific cultural communities is really critical.
Thanks, Akram. And before we move on from this question of adapting to COVID-19 and get into learning more about your equity incentive, is there anything that you guys are doing right now that you adapted to because of COVID that you plan on continuing? Something that you maybe hadn't planned on when you were working on your outreach, but turned out to work really well, and you plan to keep as we hopefully in the next year move out of this public health crisis?
Yeah, so one example is actually around our bonuses. So I mentioned earlier that connecting families to early childhood resources as well as financial health resources is really critical. And that's something that, you know, we're going to be building out more, especially as we move out of COVID, hopefully over the next few months and even a couple of years. And so for those, you know, we wanted to do bonuses, but we wanted to initially, the way that we had planned it is that families would be participating in new programming that was tied to their child's well-being or their family's financial health. And so we made that just a bit more flexible by saying that, you know, in 2019 and even this year and probably going forward, the family doesn't necessarily have to do something new. Like if they've already done something, participated in something related to their family's financial health, even if it's, you know, they got unemployment or they're part of a, you know, workforce program, whatever the case might be, they can get that program as long as, you know, they let us know that, you know, they did what they did, and they just provided either like a form that says they, you know, the partner verifies it, or they send us an email confirmation of, you know, something that says, hey, you're ready to attend this workshop. So that was one thing, and it's the same for our early childhood bonus as well. So we will have ones that are more specific. For instance, with WIC, like we want to do one that incentivizes the child's first birthday screening, because we know that like that's when it tends to fall off. And so as a program, we would have an opportunity to communicate to families to say, hey, it's almost your baby's first birthday, make sure you get your well baby checkup at WIC, and you will get an additional bonus. And then, you know, that's going to help them on their end, and then they're able to tell us which families have gotten that. So we will have specific ones where the families will have to do something, but for the most part right now, it's like if they've already done it, then they just have to let us know they did, and we provide that up front, because we know that last year is just, you know, everything was upside down for families. So I would say that's one adaptation that we made, which I think is actually more flexible, and we're happy to keep doing moving forward.
Well, I'm glad there's some silver linings out of all of this. I have two questions for you, Akram, that came up in the chat that are related to what you were just talking about before we move on. The first question is from Anne DeCecco at Keystone Scholars. So first she says, thank you for sharing. And Anne is curious, how did you recruit and select ambassadors?
Yes, so for our ambassadors program, we work primarily with our community partners to recruit ambassadors, as well as just, you know, word of mouth, right? We have a lot of leaders within the community that have already been doing a lot of incredible work and are very well connected to St. Paul families. And so word of mouth is huge. We work with our partners to get the word out. And then because a lot of our partners are already working with, you know, families of young children, you know, they might have someone who used to work at that organization, or who maybe is even currently working there, who might be interested in serving as an ambassador as, you know, a side thing. And so, you know, we're able to do that. Generally speaking, our ambassadors program, ambassadors get a stipend of $100 a month, and then essentially it's, you know, they can do different things, whatever activity makes the most sense for them to get the word out. They can get, you know, as creative as they want to be. And one of the examples that I gave earlier is like something that's going to be an annual event within the program going forward, right? It's going to be a staple. So I would say word of mouth, and then just our partners are the best ways that we've been able to get our ambassadors.
Great, thank you. That's helpful, and a key detail that they are being compensated in some way for participation as ambassadors. We have one other question that's related. Oh, go ahead.
If I may add, so another critical part of our ambassadors is, I wasn't sure how much detail to give, but maybe this is something that I think would be helpful for her to hear, is we're invested in them as leaders. And so not only are they out in the community talking about College Bound St. Paul with families that they have that trust and rapport for, but we also invest in them by, you know, hosting leadership workshops of topics that they're interested in. And we usually do 4 for each of the cohorts. So, you know, at the beginning, we asked them what topics they were interested in. You know, there was a topic on how to communicate across cultures. We have one coming up on public speaking that we're going to do. And then just generally speaking, like anything else that they're interested in, even if we don't have a workshop on it, you know, we still are outreach and engagement coordinator will go out of her way to make a connection to an ambassador, to somebody else within our community. As far as like the workshops, they get facilitated by community members and community leaders, and so that also provides us an opportunity to engage more of the people in our community to help build more leaders. And so I would say that's definitely one of the critical pieces that I want to make sure I mention regarding our ambassadors.
Great, that's awesome. There's one more question to clarify in your work as a program. So you talked about your community partners and how they're helping with the enrollment process and referrals. And so Amanda from Oakland Promise just wanted to clarify about your enrollment process, because in St. Paul you have a bit of a unique hybrid enrollment. So I was wondering if you could just briefly kind of clarify the 2 ways in which families can enroll in, or the families are enrolled in College Bound St. Paul.
Yeah, so there's both automatic enrollment that happens as well as the manual enrollment, which is the opt-in. So for our manual enrollment, those are for babies that had confidential birth records, so we don't get that from the health department, as well as families that move into the city. So if their child was born elsewhere and they weren't a resident at the time, but they move into St. Paul, they're still eligible as long as their child is, you know, below 6, not at this point, but like, you know, 6 years from when we launched. And so there's that piece, and they do that just through an enrollment form via our website. And then for babies that do have public birth records, we get that file from our Minnesota Department of Health on a monthly basis, and we automatically enroll them and then communicate to the families that they have an account open at like within, I would say, like 2 months to 2 months and a half, or even sometimes 3 months, that you know, they have an account. And like I said, that's our Bremer, and is a custodial account, and that's something that we get asked a lot. It's a custodial account, meaning that the child's the beneficiary, so that doesn't impact other benefits that the family might be getting, because it doesn't count it, you know, it doesn't get counted as assets. So yeah, right now it's hybrid, but we actually have a bill at the state right now to try to get access to the birth records for at birth CSA program, so that we're able to automatically enroll all families, because the barrier of the confidential birth records isn't necessarily just that, like, we're missing out on one specific group. We're actually missing out on a lot of families that would actually most benefit from the program. So that's a long-term goal that we have, to hopefully eventually move over to doing automatic enrollment when we're able to get all the birth records.
Great, thank you, Akram. It's something that's a little bit unique about St. Paul, where your agreement with for your birth records doesn't quite cover all of the St. Paul babies who would be eligible for the program. So you have to do some extra outreach and allow families to opt in. And that's where these community partnerships are so key to make sure that you're reaching all of the families that would benefit from college-bound St. Paul. So thanks for clarifying for that. There's such a wide variety of CSA programs, and everyone has their own unique procedure and ways to work with families. So thanks for clarifying on that. So we're going to move on to a question or to some information about targeted contributions. So as I said earlier in our presentation, we are moving at Prosperity Now away from the term incentives and are trying to call them targeted contributions. Please catch me if I call them incentives. We're trying to move there. But what we mean by targeted contributions are targeted benefits, right? They're also called progressive incentives. And this is a way to provide extra money to kids that are enrolled in your CSA program. So we asked this question on our survey, and what we found is that 39% of programs, so more than a third of the CSA programs that responded to our survey, have targeted benefits. And of those programs, more than half of them, so 63%, only serve participants from low-income households. And so this means that you can only enroll in the program if you're already a member of the LMI community. And so we see this with programs that are targeted. For example, Oakland Promise Brilliant Baby, their program is targeted toward families that are Medi-Cal eligible, right? So from the design, they're trying to do specific outreach with low-income households. So that's more than half of the programs that offer targeted benefits. Another 21% offer a savings match that's restricted to low-income participants. So this could be a program that has universal eligibility, but in order to qualify for a savings match, there's an income cap. We see this often in statewide programs or state programs with matching grants where they're trying to limit that savings match to really benefit families that have low income or moderate income or some other income cap. And the third way that came up in our data, one of the options was to select additional deposits for participants who are either from predominantly low-income households or attend a school with predominantly low-income students. And so for this question, participants could check either or, and we know that income data is hard to get. And so this question of additional deposits, we see in examples for programs that might provide an extra $10 for participants that qualify for free and reduced lunch on top of the initial seed deposit. So of these targeted benefits that I just walked through, these are all targeted benefits that are related to income. And we did ask if there were any targeted contributions that were related to race and ethnicity. And one of the reasons why we wanted to bring Ikram onto this webinar was to talk about your equity incentive. So this last bullet here talks about the incentive that you guys are offering, but I'm wondering if you could just explain it in your own words, talk about what the equity bonus is and how on earth you got to make it happen with a publicly funded or a publicly run program. There's a lot of programs that are interested in it and are trying to figure out the mechanics of how to make it happen. So tell us about your equity incentive.
Yes, definitely. So our equity bonus, and we call incentives bonuses. So if I say bonus, I'm talking about incentives essentially. So it's for participants who are from communities that have historically been under-resourced, so BIPOC households. And even though our program is designed to be a universal program, we use the targeted universalism approach to ensure that we have targeted strategies to reach our target / equity populations, which are people that, families that would most benefit from this program. And equity was one of the core pillars of the program when the community was designing it in 2018. And so this was just one of the specific strategies to use to get at that. We don't have income data as a program because we're at birth program. So unless we're asking families what their income is through a survey after they've already been enrolled, we don't have that data. So I know a lot of programs that start in kindergarten, they're able to provide incentives for students on free or reduced lunch, and that's not an option that we have. And so for ours, as far as the historically under-resourced communities, initially we wanted to be very specific about naming them, and then one of the challenges that you alluded to is that it's really difficult to do that, being that we are a public institution. Like, we can't just say that these bonuses are only available to X, Y, and Z community. So we had to be a little more general in our language, but it's still doing what the intent was, right? Because we get at birth data, we're also able to include families that have immigrated here. So based on the parents' place of birth, we will, like, if one or more of the parents were born outside the country, then we would provide that family a bonus as well. So that was really the only challenge. We just had to be a little more general in the language, but that also is challenging because there are organizations that are like, no, we want to say which exact communities are getting it, and we can, but we just can't formally say that, if that makes sense. The equity bonus is essentially provided based on demographic data. So for those, like I said, that we have birth records for, it's based on where their parents were born. And then for those that are opt-ins, we get their demographic info through the enrollment form that they complete online. And then families that are auto-enrollments can later, once they log into their savings account, complete a program bonus, which also has information about demographics. And so we can reach any families that were missed out in the other two strategies that I mentioned. And so those are some ways that we've been able to get at it. And honestly, this was one of the bonuses, or one of the key pieces of the program that was a non-negotiable for everyone, and specifically for the community, because we know that that's a need.
Thanks for sharing some of that context. Can you talk about if you received any pushback in trying to get this bonus implemented? I know you had tremendous support from the mayor's office, and you're in a relatively progressive city, but did you have to build the case at all for why this was a non-negotiable, or did you find that your community members, funders, other stakeholders were in alignment with this shared goal of focusing on equity?
No, I think it was essentially a shared goal, and so that's what made it easier. We really didn't have any pushback. I think this was something that was a non-negotiable even when it came to the funders, because like, these are communities that they want to make sure are reached as well. And so like I said, the only challenge was just around the language used to define what this bonus is, which obviously just goes through our city attorney's office. But outside of that, there really was not any pushback. I think it was one of those things where it's like, it must be done, we must find a way. We are, in the future thinking about, and I think it'll come up later when we're talking about data, but using more neighborhood data to provide additional equity bonuses to families that live within specific neighborhoods that are lower income, just to make sure that we're able to reach the families, especially the opt-ins that we really don't have demographic data or income for. And so yeah, but yeah, no pushback. I think everybody wanted to make sure that it was a key piece, and luckily we were able to get around it. But yeah, definitely, but not a huge barrier for sure.
Mm-hmm. Yeah, well, that's great that you had a smooth path to implementing this bonus that was so important to you. Do you have any recommendations for CSA programs that want to introduce one of these targeted contributions that are either getting pushback or having some issues with legal language. I know, for example, in California, it's been really challenging because of some specific statutes that prevent providing any special treatment or additional contributions by race or ethnicity. You talked about kind of making the language more general. Do you have any recommendations for programs that want to explore this?
Yeah, most definitely. I think, for some communities that making the case is going to be critical. And so like initially when we were in the design phase, we said that we wanted to have an incentive, a bonus for families that were from lower income or that have been historically under-resourced. And so just making the case around like, what does that actually mean that those communities have been historically under-resourced is going to be really helpful. And then in terms of the language, like I said, keeping it general, because if you just name the communities, like that you're going to have policy issues with that. And so keeping it a little more open-ended, and that will also provide you the flexibility to kind of get at those families in a number of angles, like I mentioned, because like we do that in a number of angles, and there's like more angles that we want to explore going forward. But I would say just the fact that as a city that's something that's important to us helped a lot, and we didn't come across any specific statutes or anything like that prevented us from going forward with this. So I would say, yeah, keep the language general, and then, have the community be the ones that say like, this is critical, right? Because if it's a non-negotiable for the community, then it's going to be really hard for anyone else to argue that. And then if the barrier is like the actual language, then that's something that I think can easily be fixed. But I think have it come from the communities that do understand, organizations and funders that do understand why this is critical. And that's where the universal like targeted approach that I mentioned, like especially for a lot of universal programs, if we don't have any targeted approaches, then we're really missing out on a lot of the communities that could most benefit from CSA programs. We know that for families that are from lower to moderate income households, if they have a CSA, they're 3 times more likely to go to college, 4 times more likely to graduate. We know that piece of stat is like key in our community. So anytime that anybody hears that, they're like, oh yeah, that's a no-brainer. We really need to do this. And so just, finding whatever resonates with your community to ensure that that's something that they're going to be able to push back on if there is pushback, right? So yeah, so I would say just keep the language general and then have it come from the community, because if it's coming from the community, it's a lot easier than coming from inside the system, if that makes sense.
Yeah, that makes a lot of sense. So what I'm hearing, strategies for success for you guys were having support at all levels within your organization, having grassroots and community support for the idea, funder support, and perhaps most importantly, the data that you need to be able to technically administer this incentive, right? So we know that data access is a huge challenge, but anything that we can do to help build the case that getting more demographic data is beneficial to your program and really aligns with your strategy of targeted universalism. So making it open to everyone and providing benefits to all, and then providing extra support for families who have been historically underserved within your city or state, wherever your program is. So that's why we brought you on, Akram, to talk about how you guys were able to pull this off. And we're excited to see continued development of targeted universalism within College Bound St. Paul. There's one question that I wanted to bring in from the chat from Saurabh Kohli, asking about targeted contributions instead of calling them incentives. So the question is just kind of about our shift in framing. And Ikram, I'd love for you to weigh in on this too, because as you said, and as I remember from planning your program, very specific choice to use the word bonus. So I'd love to hear if you have anything to add on to this, but I'll just say from our perspective at Prosperity Now, we've been having this conversation for several years that incentive just isn't quite the right word for all of these additional money going into CSA accounts. So a seed deposit jumpstart savings, and it could technically be viewed as an incentive for enrolling in the program, but for opt-out programs, that's not really relevant. And we realized that only in a couple of cases, right, if there's a savings match, that's an incentive to make a deposit. Or if there's a deposit bonus, that might be an incentive for taking an action. But a lot of these program contributions are just that. They're trying to add more money and trying to build savings for families without families needing to take an action, or trying to reward or provide additional funds without necessarily incentivizing a behavior change. So for example, doing a first birthday bonus, right? You don't need an incentive to turn one. You just will turn one if you're a baby. And so moving that framing from incentives to targeted contributions, in our minds, kind of reflects what the programs are actually trying to do, which is contribute additional dollars into those accounts. And so that's why we are trying to move away from calling it incentives or using incentives when we specifically are talking about savings behavior. But I'll probably call it incentives on accident 50 more times just within this call. So it's a work in progress. But Ikram, if you want to talk about why you call them bonus instead of incentive. I remember a conversation of you saying years ago, like, families aren't going to use the word incentive, like that. It's such a technical jargony term that bonus means the same thing. And so if you have anything to add on that conversation.
Yeah, most definitely. So during our task force, which is the group of folks that came together to design the program, they decided that they want to call it bonuses instead of incentives, just because that resonated better with the family, and incentives just really didn't have the right connotation that they wanted our bonuses to have. And then I completely agree with using targeted contributions, just because even for us, we do have some of our bonuses that aren't necessarily incentivizing a specific activity or a specific action on the parents' end. And we did that because when we were engaged in the community, we actually did a number of sessions on just the bonuses. So we had a list of bonuses that we, talked to the families about, and we asked them to, put stickers by which ones they favorited. And in a lot of ways, they actually voted more for the ones that didn't have an action tied to it, because they felt like, because a lot of the parents and a lot of the young parents, in particular single parents, are so busy, have to work multiple jobs, that sometimes it's going to be really hard for them to take part in activities that might be pretty easy for some families. And so it's actually those families that would most benefit from a bonus, right? So it's critical that some of the incentives don't require an action, because they were saying that they don't want their child to miss out on something just because they didn't do something on their end, right? Like that shouldn't fall back on the child and like impact their account in that way. And so, like you said, the first birthday bonus, even our equity bonus, and maybe even a couple more don't really fit under incentives, because you don't have to take action, right? Like if you're from a historically under-resourced community, then you are. So that's not really an incentive. So I really like the targeted contributions, and glad to hear that that's how you all are going to be moving forward. But that's been our experience when it came to the bonuses.
Great, thanks. And I think one note, just to clarify, that Shira also put in the chat, thank you, Shira, is that we're moving toward calling incentives contributions. And when we say targeted contributions, we're specifically talking about contributions for participants from either low to moderate income households, or participants of color, or from households of color. And so just wanted to make that clarification. And Ikram, some of the examples that you gave, I think, really speak to some of the data that we presented earlier on contributions of all types. And this to me is really kind of the next frontier of the CSA space. We still see a lot of variety in what contributions are offered. See, I just caught myself. I almost said incentives. What contributions are offered across programs, whereas we have started to see some pretty stable trends in enrollment, in that most kids are enrolled in programs with automatic enrollment. Most kids are in programs that use a 529. In the contribution incentive space, whatever you want to call it, we still see a lot of variety between savings matches, bonuses for birthdays, completing activities, and it really kind of speaks to one, the challenge of collecting and presenting any data on the CSA field, and two, that this is really a space for exploration across programs, and we don't yet have trends that are strong enough across the field where we're seeing some winnowing of contribution offerings. We really do see quite a wide array. So I'm going to move us to the next slide, where we're going to talk about what's missing in the report. So we've keyed up a little bit of this in talking about this equity bonus, but something that you may notice that's missing from our State of the Field report is race and ethnicity data and household income data. We have not presented race and ethnicity data or household income data in any of our State of the Field reports, and it's simply and unfortunately because we don't have enough data to present those findings, at least findings that would be representative for the field. So I just wanted to note that, and it's a question that we get every year. It's a question that we want to answer as an organization, which is who's enrolled in CSA programs, who's being served by CSA programs across the country. And we know that getting demographic data can be such a challenge for programs. In fact, it's usually the most cited challenge when it comes to data is we would love to have demographic data, and our agreements simply don't allow it. Whether it's data from birth records that's confidential, or working with a school district where in an opt-out program, getting any sort of demographic data is considered confidential or falls outside of what a district can share with a partner. We really just year after year continue to see programs asking for this data and missing this data, and us at the field level as well. So I just wanted to note that and share what we do have, which is we have only 22% of our total participants. So of our 900,000 and change kids that are enrolled in a CSA program, we only have race and ethnicity data for 22% of them. The data is not representative. It only includes one statewide program and a handful of large municipal programs. So we're hesitant to report anything because we know it just isn't representative of the field writ large. When it comes to household income data, we have a slightly better availability of data and response rate. We have responses that cover about half of participants, so just under 50%. And we know that when it comes to household income data, our responses to the survey, we see more use of income proxies. So for example, we will have some programs respond and say, we don't have data for our participants, but we work with X public school district, and at the district level, here's what we can share about household income data. For example, 95% of our school district students qualify for free and reduced lunch. So we see better use of proxy around this income data, less so with the race and ethnicity data. So I just wanted to ask Ikram, as someone who has some access to demographic data with your partnership with your birth records, and some that you ask for explicitly for families when they opt into the program or when they enroll, if they weren't automatically enrolled in the program. Can you just talk about what having this demographic data means for your program, and kind of what it allows you to do and how it allows you to tell the story of who's being served by your CSA program, and how that informs your strategy for where to direct outreach? There's a lot there, so feel free to take this whatever direction you want.
Yeah, most definitely. Thank you. So, in terms of having the demographic data, that has been a bit of a challenge for us too, depending on which information we're talking about. So, for example, for our babies that are automatically enrolled, which are a majority of our college-bound St. Paul families, so approximately 60%, we don't get any demographic data for them. But one thing that we do get that I mentioned is we get their parents' place of birth, which, you know, is helpful. And so we're able to use that, for instance, to distribute the equity bonus that I mentioned earlier. And then for those that are opting into the program via our enrollment form, you know, we do ask for demographic data there. So it's our opt-ins that, you know, we actually have the demographic data for. In terms of getting some of that data for those that were automatically enrolled, one way that we do that is through our family survey that families complete once they've logged into the savings account, their portal. But, you know, as you can tell, that's a lower percentage, because that means the family has to like actually log into the savings account, and then it's an optional thing that they could or can't do. I mean, it'd be great if they did, because they get an additional $50, a bonus for that. But it's a small percentage. For our referrals that we get, for instance, through WIC, we do get demographic data for that. But even the difference in the demographic, you know, what the demographic data is telling us and what we get through that versus our enrollment form was different. And so, you know, we're working on kind of aligning those going forward. The WIC data actually is like specific to specific cultural communities, which is really unique. So, for example, families that are from, you know, Ethiopia or have Ethiopian origins, like it goes down to like not just Ethiopia, but even like ethnic groups within the country, which is pretty incredible. And so as we're working with other partners, you know, that's one other piece that we're going to ask for, especially for partners that are going to be sending over referrals to us, right, based on the data that they already collected from families, as long as that family provides a consent. And then one thing that I mentioned earlier is like our wanting to focus more on local neighborhood data in order to distribute more of our equity bonuses going forward. But I think, you know, having that data, like you said, is going to better help us be able to tell the story of, you know, who's all part of College Bound St. Paul, and then can also help us get even more targeted in our approaches around connecting families to early childhood resources, as well as financial health resources, because we know that the need for each of the different communities, and specifically within the different cultural communities, varies. And so so that's critical. So for instance, you know, CLUES is one of the organizations that we work with. They serve primarily Latinx communities. And so like for them, we're working on developing an entirely new video and even other program materials that get into the details of specific questions that the families they serve have, right, around residency and all of that. Even though you don't have to be a citizen to be a part of College Bound St. Paul, like that doesn't impact it. There's still a lot of other questions that those community members have in order to feel like this is something that they can trust and can move forward with. And so so yeah, if we just had that data in advance, I think it would be helpful, because then we would just be able to get more targeted in our approaches. So in terms of income data, that's not something that we have unless a family fills out the survey. So we don't ask about income data on our enrollment form or any of that. So I would say that's probably the least data that we have, that I think, you know, over time hopefully would be helpful. But at this time, that's not really a lot of data that we collect or rely on even for the equity bonus, because that's more about background rather than income. But I think later down the road, we do want to focus on that at the neighborhood level. And then I think in order to, you know, better serve our families, the more data that we have, just the more we're going to be able to target our strategies, right? So for example, I know that within like the East African community, they have just a huge distrust with like interest, right? So for families that are Muslim, like I've had a couple of families that called and were like, hey, you know, I saw about this account and I want to close it down. And so when I was, doing a further inquiry on why they wanted to, they were like, oh, it's because of the interest. And so I had to explain to them, oh, that's something that we can actually like remove. So like it shouldn't be the barrier for you to opt out. And so after I explained it to them, they're like, oh yeah, that makes sense. Even though that information is included in the welcome kits, it can be a little bit confusing for families. And so I think if we have that data, then we're just going to be able to like actually better communicate to families to help them get a better understanding, so that, they don't do things like just automatically opt out because they feel like this is something that they can't participate in. So those are just some of the examples of why having this data is going to be important, and things that we've done to try to get the data that we do currently have.
Yeah, and I just want to commend both you and your partner at Bremer Bank, who were able to work directly on designing a product where for families that can't participate in a banking product that earns interest, that you were able to, using all of your community investigation work you did in the planning process, you were able to foresee that as a challenge and work with your bank partner to design a product where you could toggle that interest on or off to meet the needs of your families. And you would really only know that if you had demographic data, had research about who's being served by your community. So data continues, especially demographic data, continues to be a critical part of the work we do in the CSA world. And I don't know anybody who would say they wouldn't rather have more data than they have now. So we're going to move into the last slide, but I do want to give one reminder that we're going to move into Q&A. We've been answering some questions throughout, but if you have any questions for me, for Akram, about the data that we've presented or about College Bound St. Paul, please feel free to enter them now and we will be happy to get your questions answered. Our last slide is just looking ahead. So as we've seen in the data, and as you'll see in our State of the Field brief, where we talk about program goals, we have seen growing interest across the CSA field in these two key topics. One, racial equity and CSA programs, and we saw a number of programs indicate in our survey that racial equity or reducing a racial wealth gap were one of their top 3 program goals. And so we're seeing an increased interest in racial equity from our programs in 2020. And as Akram mentioned, and she's already talked about her guaranteed income pilot with the City of St. Paul, we've also seen a growing interest in guaranteed income programs, and at the national or federal level and at the state level, we've seen an increased interest in both federal and state baby bonds proposals. There's a handful of states that have proposed baby bonds, kind of large variance in how much those baby bonds are and how closely they mimic the federal bill versus how closely they mimic some existing CSA legislation. So we'll continue to provide updates on the baby bonds front. Earlier on in the session, Oliver dropped a link to one of our reports on baby bonds at the federal level. If you're interested in Cory Booker's bill, Senator Booker's bill, that's on the Senate side and sponsored by Representative Ayanna Pressley on the House side. There's a lot of exciting development and interest in baby bonds, which are similar, but there's a Venn diagram in how CSAs and baby bonds relate to each other. So I was, Akram, do you have anything that you want to add to the guaranteed income that you haven't already covered before we move into any last questions? We have one question that I want to make sure we get to, but do you have anything else you want to add about your guaranteed income program?
Yeah, I kind of talked about eligibility and program overview earlier, but I think the one piece that would be helpful to add is that our specific program is rooted in the Mayors for Guaranteed Income, which Mayor Carter was one of the founding members of, and the 3 specific strategies that they're focused on is advocate for guaranteed income at the local state and federal level, and then invest in narrative change efforts to highlight the lived experiences of economic insecurity, as well as invite other cities to join demonstration projects. And so for our specific, program, I think the long-term goal isn't that the city of St. Paul is going to be, operating that and administering that long-term, but there's research also being done to, help us get the learning that we need to help us through the narrative change, get those narrative stories so that we are able to advocate for it at the state and federal level, so that this is something that could be available to more families, right? Because right now we're just serving 150, which is what we're able to serve at this point. But hopefully in the future, this is going to be something that more families can take part in.
Great, thanks. And if you're curious, there's some new research out from the demonstration project on guaranteed income with the city of Stockton, which Mayor Carter also works with former Mayor Tubbs on guaranteed income. So there's some new research out from that. There's also a new guaranteed income pilot that was just announced for the city of Oakland, which has a lot of CSA work that's going on right now. So I think we'll continue to see kind of this twin interest in asset building, which is what CSA is addressed, and income support, which is what guaranteed income is working on. So trying to help families both save for the future and meet their needs today. And so I see guaranteed income as a really great companion to CSA programs, and neither one is sufficient without the other. So I'm glad to see those start to pop up. And Shira, again, just dropped the baby bonds 2-pager if you're looking for a quick and dirty summary of what the baby bonds legislation is and how it relates to CSA work and some challenges around the racial wealth gap. So that's there if you're interested. There are two more questions that I think we have time to answer if we answer them relatively quickly. So Ikram, both of these questions are for you. And then there's one question from Ann Yeoman about our funding data. And so the question was, is there any level of detail between fundraising and funding support for CSAs in urban versus rural areas? That's not a detail that we look at. We don't analyze by type of program or geographic location of program. What we're asking in our question is for all programs to list their funding sources and rank their funding sources in order from largest to smallest. So we have a sense of the type of funding and how much, but we don't have a sense of urban versus rural. But I will just plug that on April 7th, the Institute for Economic and Racial Equity at Brandeis, formerly IASP, will be hosting a webinar working with the Asset Funders Network, and they're specifically going to be talking about CSA funding and their new report. So they might have more information, and that's in a deeper level of analysis on the funding question. And then the last question that if you could answer in just 30 seconds, Ikram, from Kathleen Flanagan, if you could just talk about how you got your birth records for automatic enrollment programs.
Yes, so in our state, there's public birth records and there are confidential birth records, and that's all based on state statute. So for babies that are born to unwed mothers through the legal system, their birth record is confidential. And then if they're born to a wed mother through the legal system, then their birth record is public. So for those, we just, completed a data request form through the Department of Health to get that on an annual basis. And to get into the I'm not going to get into the techniques of how we do that, but basically we set up an SFTP site where the health department uploads the file on the 1st of every month for babies that were born the prior month. And then we have that set up with our financial institution. And so the required data needed to open an account goes over to them, and then the account gets open. So it's pretty straightforward. You know, we didn't have to do any like major data requests. Like, it's just, since it's public, like it's just a simple form that we filled out. But for those that are confidential birth records, it's tough, and hopefully we'll have our bill passed, you know, either this year or next year, that will help us provide more birth records, but just specifically for CSA programs. So we're not advocating that all the birth records are public. We're just advocating that at birth CSA program should have access, so that everyone who's eligible can be automatically enrolled.
Great, thank you. And we're just coming up at time, so fortunately we do need to move on to our wrap up. But if you have any unanswered questions, we will follow up with you via email and get your questions answered. So with that, I'm going to turn it over to Oliver.
Thank you, Erin. So thank you everybody for attending today. We appreciate, you know, all your questions and feedback, and also just want to thank everybody who contributed to the survey this fall as well. And your input was really helpful for the State of the Field report this year. So just a few next steps to consider. You can please, you know, take our survey at the end and share feedback. And Erin, I just lost the PowerPoint. I'm not seeing it. I don't know if you stop sharing your screen. Okay, there it is again. All right, there it is. But yeah, thank you, and share your feedback and suggestions in our survey, as well as explore our resources available on our website. Also join the Campaign for Every Kid's Future by visiting the Campaign for Every Kid's Future website. Also attend our upcoming webinars to learn more, and stay in touch. Feel free to reach out, and we'll have an email listed on an upcoming slide about how you can get in touch with us with more questions. Next slide. So this is a image from our most recent report. You can visit Prosperity Now's website to either download the PDF and read the full report. Next slide. And also you can visit the CSA section of the Prosperity Now website to view our CSA resources as well. Next slide. And again, if you have any questions, feel free to reach out to us at savingsforkids@prosperitynow.org with any additional questions. Next slide, please. Thank you, everybody. And again, please complete our survey to give us some feedback. Thank you, and have a great day, everyone.